Hey everyone, so today I wanted to talk to you about something that I've been thinking a lot about recently. Now in my 20 years going through hearing loss, I've been to many doctors, many different hospitals, meeting about my hearing loss, having tests done, all of that. And in all of my years meeting with different doctors, I have never had one that is fluent in sign language. And sometimes I wonder, how would my life have been different growing up as a kid in a hearing family with hearing loss if I had met one doctor that knew sign language and maybe recommended to my family that I learn it, or that my family start learning sign language. So sometimes I think about that, but I know so many of my deaf friends have the same problem, that their doctors don't know sign language. And so nowadays we have a few options where we can, request in advance an interpreter. But sometimes it takes many hours or many days in advance that you have to request one. In emergency situations, I've had them myself where I was in the emergency room and having trouble getting an interpreter. It just really can be a problem sometimes if you need help quickly. Or now they have these video conferencing type computers that will connect with an interpreter, and then the doctor can communicate with you that way. I have not tried those. I have not seen one since they've came out, so I don't know how well that works. But there's a few things that I thought would be helpful for doctors who don't know sign language but have deaf patients that they want to help. So I made, six different ways to help you make your deaf patient's experience better in the doctor's office. So number one is learn sign language. Yes, I know not everyone's gonna do that, but it would be awesome if you have a lot of deaf patients. If you're like ears, nose, and throat doctor, please, or an audiologist who works with deaf people like every day on a daily basis, please learn some sign language, please. So number two is always look at us when you're talking to us. I have gone to so many doctors' offices where they're asking me questions about like my family history or something, and they're looking at this computer and typing in what I'm saying while asking me questions. Well, if you're looking over here, I can't read your lips, I can't understand you. If you're looking down at a chart or distracted, I'm not going to be able to communicate with you. So look at me when you're talking. Number three is, give me directions. Give me all the information about whatever you're going to be doing, whether it's listening to my heartbeat or looking in my ears. Whatever you are going to do, tell me before you do it. Don't just start poking me or listening to my heart or putting things in my ears before you tell me what you're doing. It's not polite. Yes, it saves you time, but it makes me really uncomfortable. So tell me before you do anything, every detail about what you're gonna do, what you need me to do. So yeah, tell me before. Number four is don't assume that all of your deaf patients are the same. We all have different backgrounds, different preferences for communication. So ask us before the doctor's appointment starts how we prefer to communicate. Some people will prefer to have an interpreter there and to communicate through sign language. Some people will want you to write down everything you say. And some people will feel comfortable enough with their lip reading skills to have you just talk, but look at them when you talk. So ask before the meeting, the doctor's appointment, how we want you to communicate. And oh, for number 5, I've had this problem so many times where I go into a doctor's office and they give me, information on what to do next. If you're giving your deaf patient directions for some kind of treatment, if you want us to maybe change our diet plan or whatever it is, don't just tell us. Because things that are that important can get lost in translation. Write it down too. So explain it to us however we prefer to communicate, and write it down to make sure we understand you. Because it's so easy for me to read the number 21, but you were saying a different number, and then all of a sudden I'm doing something 21 times a week, but it was supposed to be something different, a different number. But I think I got all the information correctly, but I don't. So always write it down. Anything that's really important, any directions, write it down too, so that we have that reference, and to make sure we have the correct information. And number 6 is learn a little bit about our culture. And what I mean by that is, like, I've been called, oh, your hearing impaired patient is here. Well, in deaf culture, calling us hearing impaired is a negative thing. We prefer the word deaf or hard of hearing. So learn the little things like that, just to be polite. I mean, it's not going to be like the end of the world if you call me hearing impaired, but it's not going to make me feel really, understood and accepted, and not going to give me the greatest feeling in the world going into your office. Okay, so I hope that this was informative for you, that maybe it could help you with your next patients. Anyways, thanks so much for watching my video. If you have anything else to add, if you have awesome or really bad stories about going to the doctors as a deaf person, comment, write them down. I want to read them. Thanks for sharing your experiences, everyone. Have an awesome day. Bye.